Well, good afternoon, everyone. So, if a lot of you have been wondering what's it like being a nurse in the present day setting, that and more will be answered by today's guest. We are the fourth group from BSMLS 1A, giving you the freshest of today's occupation health safety information straight from the source. So, who is our mystery guest for today? Here's Milrose Panagiton to give us a short background. Mil?
Thank you, Emil. Our guest for today is a registered nurse from Kidapawan Doctors Hospital Incorporated, Kidapawan City. He graduated with a Bachelor of Science in Nursing at Colegio de Kidapawan in 2007. After passing the board exam in 2007, he immediately started to work as a nurse at Palomalok Municipal Hospital in 2008 to 2009. He also worked at the representative medical program provincial hospital at Kimbal, Iloilo in 2009 to 2010. He has also been a nurse at Kidapawan Medical Specialist Center in 2010 to 2011 until he moved to work at Kidapawan Doctors Hospital Incorporated up to the present time. Throughout his work experiences, he has been an ER staff nurse, head nurse for ward, head nurse for ICU, head nurse for ER, and currently is a nurse supervisor. For his expertise, he has been recognized as a registered IV therapist at St. Paul's General Hospital in Iloilo City. He is also a certified IV preceptor and certified internal auditor of ISO. Everyone, I present to you Mr. Francis Morales.
It's really nice to virtually meet you, sir. We're very thankful that despite your busy schedule, you were able to give us the chance to ask a number of questions regarding your profession.
Actually, as a nurse, I think it's a nurse is an art because we collaborate with different health professionals to promote healthy lifestyle. And also, in terms of sickness, we provide health care services to our patients to meet their optimum level of health, and also we discourage to prevent disability on this in their status. Actually, there are lots of hazards in terms to our professions, in terms of our works, especially we do different kinds of diseases in the hospital. We encounter different kinds of diseases in the hospital, especially kung meron pong needle stick injury. It's very common in our practice in the hospital. Actually, it's affect our works also. Sometimes, because of these common diseases that we encounter, we are at risk. Also, we are dealing with their lives. We are dealing such diseases. We are at risk with our own health, as well as ma-care namin yun sa pag-uwi, sometimes at least din yung family natin. So, very affected, especially yung mga patients, they are in the downsides also because they are sick. So, as a nurse or healthcare provider, we are going to uplift their conditions, not only spiritual but also the mental health also. Actually, there are some procedures or some protocols so that we can prevent those hazards. So that's why we created the health protocol in our hospital. We created the policies also in terms of dealing our patients. That's why we abide those policy and protocols. We have our infection control nurse. If there's any accidents happen, especially when it comes to our practice, it is recorded in our we we make a report on it so that the infection control nurse will intervene on the incident happen on our wards. For example, if there's an incident of needle stick injury, so our infection, we made a report first, then our infection control nurse also intervene on that happens. Then we make a necessary intervention so that we can do initial intervention so that we can create some further treatment to us, also to our colleagues. So the report is very essential because so that we know where to start and we know to prevent in the further future na it will happen again. Some of my colleagues, they are infected with this pandemic also because of this COVID-19. They are affected with this virus. So we reacted on that case. That's why we promoted some health protocols and necessary what is it? Makes to enhance our prevention. So we opted to wear a level 4 PPE right now because of that pandemic. So when it comes to dealing with that communicable diseases, so there are different kinds also of PPE we wear so that we can protect ourselves. We make case improvements so that in every actions we made, there is room for improvement. There are different kinds of risks in our workplace. There are moderate, low risk, and high risk. So in every level of risk, we make a necessary intervention on that so that in the near future, it will not happen again. From the start of admission of our patients, we have to intervene properly. We have to deal with the patient properly. So I think the protocols made by our infection control is enough right now. On my 10 years work in the hospital, maybe all of the hazards are we intervene in. So from the start of ISO 9001-2015, we accredited our hospital. So we evaluated all the risks in the hospital so that we can improve our processes and work. Maybe I don't think so if there's any more risk at all. Very common to us. Maybe kung meron pang mga risk na mag-arise, then it's time to revise our protocols or policies. Maybe we are open for revisions. That's why in every week, every year, twice kaming nagkakandak ng audit regarding our processes and procedures, so that we can know if there is any room for improvements or any inconformity in our process, so that we can intervene right after. Our program in the ISO 9001-2015 in the hospital, we conduct monthly seminars and training. The training officer make a way to conduct any regular trainings or seminars so that we will keep updated on the current issue when it comes to our practice. a health worker, maybe I maintain on, maybe I pledge on this profession so that I accept it by heart that as a health care provider, I should promote the healthy lifestyle, promote optimum level of health, and maybe conform all the health protocols and the institutions so that we can avoid any any diseases that be contacted us, and also to prevent the spread of the diseases.
After interviewing with the assigned healthcare professional, we concluded that the reality of the occupational health and safety status of today's healthcare professionals are given more attention and importance, especially during the start of the pandemic, where nurses are one of the frontliners in battling COVID-19 virus.
Moreover, the risk of occupational hazards and vulnerability to injuries increases because of the workplace hazards, physical exposures to certain diseases, and psychosocial exposures due to more intense work, time pressure, mental workload, conflicting roles, and high monotonous work. Therefore, the healthcare professional's occupational health and safety status must be a vital concern.
Developing and implementing a workplace health management strategy at hospitals or other medical facilities is an important step and activity that should be carried out by all levels of management. We know for a fact that having nurses who are actually healthy and well rested is very important to the effective management of healthcare. With this being said, what we can suggest is to develop tools that will help nurses measure and evaluate the impact of various health, safety, and environmental outcomes on their personal and professional lives to further assess their well-being and to have the option to make essential changes in accordance in the workplace of the health management system of the medical facility.
It is also recommended that hospitals and health services ensure that occupational health and safety is managed in a systematic manner in accordance with relevant legislation and standards, and that nurses are given the highest level of protection against health and safety risks that is reasonably practicable in the circumstances. Roadmaps to improve employee access to key interventions and services for the prevention and control of work-related illnesses can also be developed. These include keeping track of coverage and setting realistic health and cultural goals based on human and financial resources.
Nurses have a unique scope of practice, and since it's a caring profession, they are directly involved with patients. Having the proper training to prevent injuries associated with patient handling is one of their safety measures, which may reduce harm and risk that may occur to both patients and healthcare workers.
And it is unique in a way that it requires both physical and psychological demands, such as patient lifting in awkward postures, protective devices to prevent needle stick injuries, chemical exposures, and potential for violence. Not to mention that they are employed under alternative arrangements, which makes the safety measure complex and a case-to-case basis.
Safe patient handling lowers the risk of injury for both healthcare personnel, such as nurses, and patients, while also increasing patient care quality. This is critical to providing constant monitoring, a compassionate patient care, and yielding